Hi, I'm Chloe,
And I'm Aidan.
and we've produced this video to try and help you understand what Klinik is and how to use it. These are the topics we'll talk about today. So, what is Klinik? As of the 1st November this year, your 3 local GP practices have merged and have changed the way in which you book appointments.
You now need to book appointments through Klinik, which you can access through the yellow banner on the front page of your local practice website, shown here.
Klinik is a new online service where you fill out a form submitting details of your illness or request to your practice. You can use Klinik for a variety of purposes, ranging from booking appointments to queries about your repeat medications and prescriptions, to requesting sick notes for work, called fit notes, and more.
All health problems you submit will be viewed by the clinical team, consisting of doctors from the 3 GP practices. They will review your submission and give appropriate appointment times to patients, depending on how urgently you need to be seen. All admin queries, for instance insurance claims, will be directed to the admin team, consisting of reception staff from the practices.
The aim of the new system is to provide same-day outcomes for every Klinik submission, whether that outcome is a same-day appointment or an appointment in a few days' time. These can be either face-to-face or telephone appointments. The patient will then be contacted about the outcome of their submission.
So what are the benefits of the new system? The new system now allows doctors to see who needs care most urgently, since the system will flag emergency cases, as well as provide a list of all patients who've submitted forms. This is beneficial as it removes the first come first served system. Previously you'd have to call into the practice starting from 8 AM, which often led to long wait times and a potential for urgent patients to miss out on a day's appointments. This led to delays in receiving care, to the detriment of patients.
Now you can submit a Klinik form, avoiding the phone queues, whilst giving the doctors a more detailed overview of your illness. This allows you to go about your day and be contacted back with an outcome from the practice. Another benefit is that those who are extremely unwell will likely receive a same-day appointment if possible. For those who don't need to be seen immediately, the system does not disregard their need to see a GP. They will still be contacted to have an appointment at a later date or time.
If the GP decides an appointment is not necessary, they will also contact you about this. Every submission should receive a call or text back within 12 hours. The system also makes it easier to use remote services. This includes certain medication queries that may not require a face-to-face appointment, and instead a phone call with a pharmacist may be better. This reduces unnecessary travel to the GP, saving both patients and doctors time.
Finally, the new system allows for better coordination of care for the 20,000 patients across our 3 practices, with services from all 3 now working together, allowing us to use the resources of every practice in the best interest of the patient.
Overall, the new system should reduce wait times for patients and result in better care for all. With this new system, we understand there will be some initial apprehension. We ask that if you are able to, please try and engage with Klinik yourself and fill out a form whenever you need to book an appointment.
However, if you struggle to use the online system, patients are welcome to call or come into their practice. Reception will then help you fill out a Klinik form. Patients should be aware that often this process can take longer, since reception staff will work through the Klinik form questions with you.
Also, the system will only allow submissions during practice opening hours, from 7:30 AM to 5 PM, Monday to Friday. This is in order to prevent a large backlog of patients trying to access the GP when they're closed and cannot give you the care you need. The Klinik system should reopen for submissions the next working day at 7:30 AM. If you need medical care outside of practice opening hours, we recommend you contact 111, and, in the case of emergency care, call 999 or go to A&E.
Finally, we would like to highlight that Klinik is here to allow us to deliver the same effective care that we previously were able to provide. Whilst patients will now have to fill out a form to access their practice, the aim is not to funnel patients away from the GP, and is instead to allow for better prioritisation of care. Everyone who needs to be seen will be seen.
If you'd like to know more about how to use Klinik, we also have a separate tutorial on filling out a Klinik form. If you'd like to leave any feedback, please call into your GP practice
Or fill out the feedback form on the front page of your practice website. Thank you for watching.